Hello everybody, this is Gary. Today is Friday, March 11th, 2022. It is 1:54 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today I'm doing pretty good. I stuck to my daily schedule today. I did work on my computer. I'm making this video. I meditated this morning. I did some workout on my workout exercise bike. I did my physical therapy exercises. I'll be meditating later tonight before I go to bed. I saw my psychiatrist yesterday. We agreed to continue my Klonopin indefinitely because it's very helpful, along with the Zyprexa. It's helped keep me out of the psychiatric emergency room. The last time I went to the psychiatric emergency room was October 30th of last year. So it's been about 4 months and I'm doing well. And we didn't put any end date on my stopping the Klonopin. And we didn't change any of my other medications. My paranoia has been worse over the past few days, and we talked about that, but we agreed not to increase my Zyprexa. Instead, I'm going to use my coping skills to cope with my increased paranoia and my increased delusions and my increased hallucinations. My anxiety and depression aren't that bad today. My auditory hallucinations are a little bit more intense than normal, and my paranoia and delusions are a little bit more intense than normal, but I'm in control of my behavior. I'm not violent and I'm not suicidal. So we didn't change any of my medications when I saw my psychiatrist yesterday. We did talk about the fact that my psychiatrist is a resident psychiatrist, which means he's a medical doctor. He can prescribe meds, but he's still in the learning process of his career, and his assignment to me was temporary, and he will be leaving in June. So I will be getting a new psychiatrist in June of this year. So I have to get used to the idea of seeing a different psychiatrist. But this happens every year at my clinic. The psychiatrists they assign me are resident psychiatrists. They're fully licensed psychiatrists that can prescribe meds, but they're also still, in a certain sense, in the learning phase of their career, and they move on to something else eventually. So I will be getting a new psychiatrist in June. I still have the same psychotherapist, and I will continue on with group therapy. I went through the first 10-week block of group therapy, and then there's a second 10-week block that starts in late March. So group therapy is for something called DBT therapy, or dialectic behavior therapy. It's a form of therapy to help people deal with distressing situations, including their internal psychiatric symptoms and external stressful events. When I talked to my psychiatrist about increasing my Zyprexa, we agreed not to do that. We would, because my paranoia and delusions have gotten worse over the past few days and the past week, and my hallucinations are a little bit more intense, my auditory hallucinations. But we agreed that I would use my coping skills that I learned in DBT therapy to deal with those things and not increase the amount of Zyprexa I'm taking. We did agree to continue my Klonopin for anxiety. It's very helpful. It keeps me out of the psychiatric emergency room. I haven't been to the psychiatric emergency room since October 30th of last year, so it's been about 4 months. I don't like going to the psychiatric emergency room. It's chaotic, it's violent, it's loud, and it's noisy, and it's overcrowded. And it's a locked facility. Once you're in, you can't get out until you see the psychiatrist, which in some cases may take 2 or 3 days, from several hours to 2 or 3 days, depending on how crowded they are. And they shove everybody together into a very small room. So we agreed to continue the Klonopin as a tool to help keep me out of the psychiatric emergency room along with the Zyprexa. And we didn't change any of my other psychiatric meds. I'm still taking the Cymbalta for physical pain. It's reduced most of my nerve pain, muscular skeletal pain, nerve pain, joint pain. My right knee is still bothering me. It was bothering me really bad yesterday because I had to go outside and walk on it. I had to keep a psychiatric appointment, and I had to go food shopping, and so I was walking on my knee all day, and it hurt really bad by the end of the day. It still hurts today, not as bad as yesterday. I did exercise on my exercise bike. That doesn't put a lot of pressure on my knee because when I use the exercise bike, I'm not burying any weight down on my right knee. We are planning to do an MRI of my right knee on the March 24th to see if there's any tissue damage, tendon damage, cartilage damage. We already did an x-ray and there's no broken bones or dislocation of the joint. But there's certain things that could be damaged that would not show up on an x-ray. So I'm dealing with physical pain in my right knee, and most of my body pain and joint pain is gone because of my taking Cymbalta, which is an antidepressant, but it also helps control physical nerve pain and body pain. It's possible that I have fibromyalgia. I'm also taking Neurontin for pain, Tylenol for pain, Flexeril for muscle spasms, and Aleve for joint inflammation and pain, especially in my right knee. So my paranoia is a little bit more intense than usual. My auditory hallucinations are a little bit more intense than usual, but I'm coping well. I'm in control of my behavior. I'm not suicidal and I'm not violent, and I am just trying to keep myself structured and into my daily schedule. That's all for now.